Ebola is here with us, and its impact on us is real.
Midday in Kanema, Sierra Leone, and there's only one topic that dominates the airwaves: the outbreak of Ebola that's claimed around 1,500 lives in West Africa since March. Broadcasts like these are essential to spread information about how to stop the spread of the deadly disease.
The radio is telling us how really the disease is. They are telling us how really, if even you have Ebola patient or even any other person, that you should take it to the Ebola hospital.
90% of the population in Sierra Leone gets their news from the radio, putting presenters like Saruna on the front line in the fight against Ebola. At this training day in Freetown, journalists are learning how to explain the disease to their listeners. They're also being taught what tone to take and urged not to joke about it.
I know that DJs are expected to be animated. However, please be very sensitive in the jokes that you crack about Ebola. It is not a joking business.
Health experts are also turning to journalists to debunk the rumours which have helped the disease spread so quickly. These range from a belief in traditional cures to a distrust of Western medicine and even what steps the government might take.
There were a number of rumors. For example, there was a rumor that the government was going to shut down the country for about 21 days, or that, for example, every Monday was going to be declared a public holiday.
At Sky Radio in Freetown, listeners can text in their questions in Creole dialect, giving presenters like Enid Ross Richards the chance to tackle these rumours head-on.
Normally they ask the normal ask questions. If I eat with somebody, will I contact Ebola? Should I go to the hospital if I'm sick? Because I've heard that when you go to the hospital, they'll inject you and you will die, and things like that. Should I go to the hospital if I'm sick? And obviously, if you are sick, you have to go to the hospital.
Ebola has now claimed at least 400 lives in Sierra Leone, and the death toll continues to rise. But amongst the crackle of bad news, there's also a little bit of hope.
141 individuals diagnosed with Ebola have been treated, recovered, and discharged as Ebola-free.